into the morning. I have a gentleman here, Dr. Solomon Mutua, an oncologist with expertise in medical and radiation oncology, based at the Nairobi West Hospital. And today we are talking about the different kinds of cancers because it's Cancer Awareness Month. And I was asking him, how many Cancer Awareness Months are there in a year? And he told me it's something that we speak about continuously, as the effects of cancer is continuing to ravage people in the community. So it's better to keep on creating awareness. Good morning, Daktari.
Good morning, Nick.
How are you?
I'm good, thanks. How are you?
Very good. Welcome to my office. This is Hot 96.
Thank you very much. It's an honor to be here.
Yes.
Yes.
So you were telling me cancer, and there's various kinds. I think last month was cancer awareness also, but we're concentrating on for kids, or there's different kinds of cancer awarenesses.
Yes. Usually every month there's usually a dedicated cancer subtype, but usually, as you say, this is a conversation that we'd like to have, if possible, on a daily basis. Okay. Yeah, so today basically we'll be focusing on HPV associated cancers.
Yes.
Okay, there are 5 main cancers that are associated with HPV, but the commonest, which we will discuss at the tail end of the discussion, is cancer of the cervix.
And you say that these are sexually transmitted cancers?
Yes, these are mainly sexually transmitted, in quotes, mainly because HPV is sexually transmitted. Actually, it's the most common sexually transmitted infection, and that's why we chose this important topic today.
All right. So HPV only causes cancers, or there's other?
HPV stands for human papillomavirus, so it causes cancer, which are the malignant diseases of different parts of the bodies, but also can cause some benign conditions. These are conditions that are not really harmful to life, threatening to life, but they are growths that can occur that can be a nuisance, but not necessarily translate to cancer. And most of the time, HPV infection doesn't cause anything. It's just a transient infection that someone acquires, and it clears by itself within 12 months of acquisition. So most of the time, someone may walk around having HPV and they don't even know that they have the infection. And this is what makes it dangerous, because this is when actually transmission can occur without even someone knowing that they're actually transmitting the virus.
So it's a very common infection.
It is very common. Around 80% of the human race at some point in their lives have been exposed to HPV virus infection. And actually some experts argue that virtually everyone who is sexually active at some point of their lives will actually get infected with HPV.
So is it a natural occurring?
It's not natural occurring. It's an illness.
No, the papilloma virus, I mean.
Natural.
Like the way people have, like a flu virus. Is it just something that?
It's very common, but again, it is transmitted, and this transmission is sexual transmission. Yeah.
All right.
Yes.
Are there more than one HPV variants?
Yes. There are around 200 different HPV variants. Okay, they're usually labeled in numbers like 1, 2, 11, 16, 18. But out of those, there are those common ones, and there are those that are associated. There are those that are low risk, associated with the benign diseases that are not harmful to life, and there are those that cause cancer or precancerous diseases in the body, and these are mainly HPV 16 and 18. Those are the 2 main common ones that usually cause are associated with cancer, basically. Yeah. So 218, 16, 18, 33, 31, 45, so they're just given numbers.
Who's in charge of coming up with this number? I know the one that's bothering us now is 19. So like 16, 18 must be as bad as COVID-19. Anyway, so which body parts, besides, are there main body parts that are affected by HPV?
Yeah. So basically, when you think about HPV, think about sexual interaction. Okay, so the body parts that will be affected mostly by the high risk variants are the sexual organs, basically. So we have the cervix, the vagina, the vulva, which is the female external genitalia. We have the anus, the penis, and also the throat. Okay, because nowadays, there's oral sex and it still gets...
I was waiting for you to talk about that. Okay.
So it can get transmitted through the throat. And the most important thing about HPV is that, and this I think it's very, very important to understand, is usually when you talk about sexual interaction, penetration is not a must for HPV transmission to occur. Okay. As long as there is contact, skin to skin contact, as long as there is genital contact, or genital anal contact, or genital oral contact, then this is enough for transmission. Another way that can increase the risk of transmission is also toys. Okay. Nowadays people use sex toys. Fingers also can be used to transmit the virus from infected genitalia to another. Even something as not really innocent, but something as French kissing. Okay, this intimate open mouth kissing can actually be used to transmit HPV virus, especially to the throat, from one person to another. So it's a very highly and very easily transmissible virus. When we get out of the anogenital region, there are those that are benign, that can affect the hands. These are usually caused by the low grade or the low risk HPV viruses that you'll see even young kids actually transmitting it amongst themselves without knowing. We can also have butchers, the what we call butcher's warts, which also get transmitted. So basically the body parts, the hands, and the throat, and also the anogenital regions.
So now those dance for the hands and are low risk.
Yeah, those are the low risk. All they cause is just tumors that cannot harm life, basically. Yeah.
And how are those ones treated?
Those ones mainly they're treated by there's some chemicals, what we call caustic pencils, which usually can be prescribed, and someone is just shown how to apply, and slowly that caustic chemical just slowly burns them out, and within a week or two those benign warts are treated and gone. Yeah.
All right. So HPV, as you've said, is transmitted through contact with other people in a sexual manner. Is there a way you can prevent yourself from getting HPV?
The best tool is just having safe sexual practices. Okay.
But how safe can you be? Because you've said even fingers, your mouth.
In terms of safe here, I'm talking about sexual behavior. Okay. Because someone who has multiple sexual partners, early sexual debut, having a partner who has multiple sexual partners, those are some of the risk factors. So being safe here, I'm all talking about sexual fidelity, basically. Okay, keeping safe, playing safe. Okay. Condoms can also help to some degree, because consistent and good or proper use of condoms can help prevent.
Do you have a vaccine for it? Is there anything that's happening in the medical world?
Yes. We do have vaccine, and in the world we have 3 main vaccines
for HPV.
We have one that targets two subtypes, which is subtypes 6 and 11, and these are mainly the subtypes that cause the benign lesions, the warts, all that. We also have another one that targets 4. It's called a quadrivalent. Okay, and this one usually targets the 4 main variants that cause precancerous, cancerous, and also the benign lesions. And we have now one which targets around 9 subtypes. Okay, I don't think we have that in Kenya yet, but in Kenya we have the 2 and the bivalent and the quadrivalent vaccine. Another important thing about vaccination is it really, really helps, and the recommended age group is between 9 to 14 years.
To get the
vaccine, and this is very important for the parents to understand, because the rationale, the thinking behind this is, since HPV is mainly sexually transmitted, you want to make a difference before people start becoming sexually active. So between 9 and 14 years, this is the best time, because once they sail into teenagehood, now they start becoming sexually curious and start indulging into sexual practices. Okay. How is this given? It's just an injection. Between 9 to 14 years, 2 doses usually suffice. You get 1 dose and another one within 5 months, around 6 months. And the vaccine is basically for both male and female, not just for female, because we know the males can also get HPV infection. So the target is both sexes. And after 15 years, that is what we call catch-up vaccination.
Almost like a booster. No?
Yeah, usually when you start at 15 years up to 26 years, now you're recommended 3 main doses as opposed to 2. 1 at day 0, another one or 2 months later, and the third one, which is the booster, at around 6 months. Okay, and this has really shown to reduce the HPV infection by around 90%. And also the important thing about this vaccine is it has 2 main modes of protection. It protects the person who has been vaccinated directly, and also those who are not vaccinated. So it also has what we call herd immunity, because the more people you vaccinate, there'll be less HPV in circulation, and in effect, you'll also be protecting those who are not being vaccinated. So basically, there is a vaccine in Kenya, and the government also has rolled out a program, but this program is a bit limited, but it's a very good start. It targets young girls around 10 years of age to have enrolled vaccine into the Kenya vaccination program. So basically right now 10-year-olds in schools, girls, are getting vaccinated.
So earlier on you spoke about benign infections. Is it benign cancer? That's the one that you have, but it's not really harmful and can be taken care of, like the way you're talking about the vaccines. Is there a point that HPV can go all out and really mess you up?
Yes, especially the more exposure someone gets, the more risk of getting the different HPV variants. And
so that's many partners,
or having a partner who has many partners, because you can decide, I am good, I'm safe, I don't have multiple partners, but your partner has multiple partners.
So he picks HPV 16, 34, 18.
Yes, and transmit it. So when this happens, then most of these infections are transient, meaning you get infected, you don't even know you have anything, and within 12 months, your body has cleared. But the problem really comes in when now you have persistent infection, because with persistence of infection, now there's an opportunity of things to transform into precancerous and cancerous lesions. And these are now, it can cause cancer of the cervix, cancer of the vagina, cancer of the vulva, cancer of the penis.
Oh, there's also one for
yes,
okay.
Cancer of the penis can also come about, though it's not common, but it is there, we see it. And cancer of the anus, and this is basically important because of men who have sex with men, or women who have sex in men, but indulge in anal pleasures. Mm-hmm. And then also it can cause cancer of the throat, okay, which we call cancer of the oropharynx, basically. So it can mess someone up, okay, but the good thing is it's something that can be preventable.
All right. So I'm assuming, now that you've told me that it gets really bad, what exactly is cancer of the cervix? Like, what happens? What's, for someone who is a layman?
Yeah. So basically, cancer of the cervix. I'll start by defining what the cervix is.
Okay.
The cervix is one of the genitalia of the female. Okay. This is the anatomical location between the uterus, which is the womb, and the vagina. Okay. So it's like a doorway into the womb.
Or reception.
Yes. Yeah. So basically, cancer of the cervix occurs when now there's a mutation that causes abnormal growth of cancerous cells in the cervix. Okay. And mainly it's caused by HPV. That's 80 to 90% of cancer of the cervix are caused by HPV. But also we have other risk factors that can cause HPV. Things like cigarette smoking, things like immunosuppression, mainly HIV infection. Okay. Things like poor socioeconomic status, because we know the poverty comes with unsafe practices, mainly because of lack of financial capability to protect yourself.
And cigarette smoking?
Cigarette smoking, cigarettes has toxins, and these toxins, like any other part of the body, they can cause damage to the DNA, of that particular area, and therefore causing abnormal growth of cells in that area, which leads to cancer. So basically it's just the toxic effect of the cigarette smoking itself.
Oh, so as it's in your body, it needs
Yes.
to leave, but now it mixes with other things, and then...
Yes, and causes damage to the DNA
Wow.
of the cells.
Wow. Are there symptoms, like you said, the virus stays in your body for 12 months, then exits? So I'm assuming by the time you notice that you've got the initial stages of cancer of the cervix,
Yeah.
you'll be so many months or years in.
Yeah. Actually, by the time cancer of the cervix becomes cancer of the cervix, there are usually some transformation that occurs.
Okay.
From the normal cell slowly transforms. We usually call them cervical intraepithelial neoplasia. Forget about that. But it just shows
I was going to write that down.
it just shows the different stages. It's like a gradual process.
Okay.
And this is why screening, which we shall talk about, is very important, because these changes can usually be seen when actually they are looked for. So to answer your question, when cancer of the cervix is early, it is without symptoms. Okay. By the time someone is starting to get symptoms, now you know that this is cancer that has been with me for some time, because this precancerous phase takes time.
How many years approximately? 3?
Around 3 to 5 years,
3 to
depending
5.
on different people, around 5 years by the time it becomes cancer. And these symptoms, when cancer is early, is without symptoms. So, but when it starts advancing now, you start getting something like abnormal vaginal bleeding, and this is basically bleeding that is unusual from the normal cycle. Okay.
What's normal?
The normal cycle is the normal menstrual period, okay? Once every month, depending on the cycle. Some have 26-day cycles, some have 28-day cycles. So when you have bleeding in between your menstruation, then this can be a sign of that. Another abnormal bleeding is bleeding during sexual intercourse. Okay, ideally there shouldn't be bleeding. So when there is bleeding, when a lady notices that they are bleeding during intercourse or after intercourse, then they should get checked. Okay, pain. Okay, and this is usually pain in the pelvic area or in the lower abdomen, and most often than not it radiates to the back. Okay, that's usually the classical symptom of cancer of the cervix, basically.
And is it as painful as, we hear women complaining about cramps before their cycle starts? Is it something similar, or will they be able to separate the difference?
It could be similar, but because it can occur even when they're not expecting their periods, then they will definitely be able to tell the difference and notice that there's something that is wrong. Okay, and as it continues advancing and getting bigger and bigger, then it starts infiltrating or going into the nearby structures, which is the rectum, the bladder, so they can have pain when passing stool, or even having constipation, okay, or pain when passing urine. Someone urinates and they get this burning sensation during urination. And as it continues getting bigger and bigger, you get more pain in the lower limbs or even swelling of the lower limbs. And when it gets really advanced, what we call stage 4 disease, and it has spread to other parts of the bodies, now here the symptoms will just depend on which part of the body. If it's gone to the lungs, you'll have coughing, difficulty in breathing. In the liver, in the abdomen, you'll get abdominal pains. In the bones, bone pains, fractures, and just other constitutional symptoms like weight loss, poor appetite, just looking all weak and sick. So it all depends on how early or how advanced it is, basically.
So what happens in screening? Because I'm assuming if, these areas where the cervix is also accessed by a different kind of doctor, a gynecologist. Yeah. Would they be able to tell that there's something wrong with you?
Yes. Screening is very important, and out of the many cancers that we have in the world, we can only screen for 5 cancers.
Okay.
And cervical cancer is one of them.
Mm-hmm.
What do I mean by screening? Screening is basically looking for cancer in the normal population. You just take someone who's not sick and you tell them, let's do something that will tell us whether or not you're at risk of developing a certain cancer or if you have cancer. And the good thing about screening is, especially cancer of the cervix, is that the 5 years I was talking about, those changes that occur before it becomes cancer, they can actually be arrested. That's why screening worldwide has been shown to reduce death from cancer of the cervix. So it's something very recommendable. And who should be screened? Basically, any woman who is sexually active has or should be screened for cancer of the cervix. And usually the recommended age is around 21 years. And what usually happens is a pap smear. Okay, a pap smear is a procedure that is done by the gynecologist, or even nurses have been trained to do a pap smear, and usually a lady undergoes examination and some swab is taken from the cervix. Okay, and this swab is now tested in the lab to tell us whether or not there are any risk of developing cancer of the cervix.
Yes.
And the interval that should be done between 21 and 29 years of age, a pap smear should be done once every 3 years. Okay, it doesn't have to be done every year.
Mm-hmm.
Once every 3 years is okay. And from the age of 30 to 65, there are 2 ways to go about it. You can just do a simple pap smear once every 3 years until the age of 65, or you can do what we call HPV pap smear co-testing, okay, where a pap smear is taken and it's evaluated for changes that usually occur with HPV infection, and also HPV testing is also done. And if this is done, and this is the gold standard recommended, if this is done, then someone can do it once every 5 years as opposed to once every 3 years.
So the HPV also affects men.
Yes.
So maybe now you can tell it, you've told us about how women will go about it. Maybe tell us, for men, how to go about it. Are there symptoms? Do we need to go and get a checkup? When do we know things are getting bad? You're the doctor, tell me.
Yeah, for men, basically 3 types of cancers can occur associated with HPV.
Okay.
First one, the penis, for obvious reasons. We know HPV is mainly sexually transmitted, mainly affecting the anogenital regions. So cancer of the penis can occur. Apart from cancer of the penis, we also have cancer of the anus, okay, mainly because of men having sex with men. And the third one is cancer of the throat.
Is that the medical term? Because I've never had them. Testicular cancer is the first one, or this is different?
This is not testicular. This is penile
Oh,
cancer.
there's a penile cancer.
Yes, there
and
is.
Anal and
Yes.
You learn something every day.
Basically, every part of the body except the hair and the nails can get cancer.
Okay.
So think about any anatomical site, it can get cancer. And when you talk about men and HPV, then this will be cancer of the penis, cancer of the anus, and cancer of the throat. So when you come to cancer of the throat, basically it's easy to detect, okay, because the only problem is, the unfortunate bit about the men now with these cancer sites is, whereas there is a test that you can do to detect whether someone has HPV infection, unfortunately for the anus or the penis, you can't really test for HPV. These tests are there, but they are really for research purposes, and they don't really have any clinical application. For the throat, the unfortunate bit is there is no screening, or you can't detect it early before it gets to cancer. So the only way you can test is once you see a mass that is cancerous, and you take a biopsy and you go and test it, and you find that this is actually cancer, and it's cancer that is HPV associated. Okay, so
for men, you just have to wait until you get it for you to find out. I think like the medical world has left us behind.
I guess it's just the clinical utility which hasn't been approved yet.
Mm-hmm.
Yeah, so basically that's how it goes. And for symptoms, basically, most of the time it will just be a growth, especially in the throat. You'll feel like a lump, have pain during swallowing.
Mm-hmm.
Okay.
Yeah.
Sometimes the pain can radiate to the ears. This shows that the mass is actually getting bigger and bigger.
Okay.
People can have problems talking or hoarseness of voice. Okay. They can have some bleeding in the sputum. Okay. And as it grows more and more, then the symptoms become more severe. When it comes to the anus, again, it will be like an ulcer, okay, or a mass, a growth, okay, and this can become painful, okay, or bleeding when someone is passing stool, okay, and basically as it advances, also bleeding, pain around the pelvic region. So it's something that once it's there, you can't really ignore it. You'll feel it.
You'll feel it at the beginning stages, pretty much.
Yes. Cancer of the penis also can occur as an ulcer, okay, and or a growth or a mass, and slowly gets bigger and bigger, and as it grows bigger, of course, it is noticeable. The individual can notice that something is wrong, and as it can also cause pain, bleeding, lymph nodes around the groin area.
Maybe now you can tell us about the treatment. Because I've heard about cancer before, so I know when it gets to stage 4, that's usually a very bad place to be.
Yes.
But there's treatments.
Yes, basically, because cancer of the cervix is the commonest HPV associated, we can talk about treatment of this, and basically, when someone feels that something is wrong and they go to their doctor, the doctor will examine them, and once they feel a mass or an unusual growth, they'll take a biopsy.
Yes.
Once they take a biopsy, this goes to the lab, and the pathologist in the lab actually confirms that this is indeed cancer of the cervix. And once we get this diagnosis, what we do is we do some investigations that enable us to stage, because treatment basically is tailored to the different stages. Okay, so these are usually scans. We mainly do scans of the chest, of the abdomen, and the pelvis. And the reason why we do the whole body is because we not only want to know the extent of the cancer locally, but also we want to know whether or not it has spread to other parts. That is what staging is all about. Is this a localized disease? Is it a local regional disease? Or is it a disease that has already spread, which people call a stage 4 disease? So Early disease, most often than not in our region, we miss the opportunity to get cancers at the early stages, and this is basically because of societal poor health-seeking behaviors. Okay, people wait until something is painful
Well, that's a
or
man thing.
unbearable.
Like if you can't walk, that's when you go to hospital.
Yeah. So for this reason, most of the cancers we don't get them early. Okay, but if we are lucky enough to get them early, then usually a cure is a guarantee. Okay, and most of the time, cancer of the cervix that is early, usually they go for surgery. Okay, which involves removal of the uterus.
It has to be removed.
Yeah, the uterus, the cervix, sometimes even the lymph nodes have to be removed. And once surgery is done, then it's taken to the lab, so that to make sure that we've gotten everything out, and to let us know if surgery was enough or if you need any more treatment. And more treatment here, I mean if you need radiotherapy or chemotherapy. And these are all facilities that we offer at Nairobi West Hospital. And when the cancer becomes locally advanced, then this is beyond surgery. And by locally advanced here, you mean it's not just in the cervix. It has started going into the cervix, on the pelvic side walls. It has infiltrated into the surrounding structures like the bladder or the rectum. So surgery in this case usually causes a bit more morbidity or more harm to the patient. So they are better off just getting treated with all the organs intact. And here the main treatment modality is radiotherapy combined with chemotherapy. Okay, and this is something that we take our patients through when they come to Nairobi West Hospital. And the good thing is the equipment that we have at our hospital is quite sophisticated, actually, and it enables us to treat our patients to very good high doses while reducing the side effects or the morbidity as much as possible. The third category in this is the stage 4 disease.
Yes.
Now, this is what we call the advanced cancer. And this is cancer that has migrated from where it was and spread to other organs. This is a stage where the cancer is not curable, but it is treatable. Okay, so you can't offer these patients surgery because it won't really help. You can't go and remove every small site that has been affected to cancer. So it would be really a fool's errand to offer surgery to such patients. We can offer them radiotherapy. And in this case, it will be what we call palliative radiotherapy, mainly to control symptoms and improve the quality of life of these patients. Okay. But the main gold standards is what we call systemic therapy, which is chemotherapy, and what also now we have targeted therapy. And this is basically these are medications that are given IV to go into the body and just look for any small cancer cell that has spread anywhere in the body and controls it, basically. So at stage 4, at advanced disease, it's not a stage you would want your patient to reach, okay, because it's usually a bit difficult to deal with, and the fact that you can't cure this disease, you just know that it will always be disturbing these patients. These are diseases usually you control them for some time and then they flare up again, and then you go back in, control them, and then they flare up. So it's not a place that even for the oncologist they'd want to find themselves in. But basically there is treatment for all stages of cancer. Yeah.